Hello, everybody, and thank you for the opportunity to speak about mindfully navigating CIRS recovery through meditation. I'm looking forward to this being an educational and experiential talk for you. Let me share the screen. A little bit about me. I am a certified speech and language pathologist, a certified mindfulness meditation teacher, a grief educator and peer-to-peer support, shoemaker proficiency partner diplomat, founder of Meditation for CIRS, hostess of the Heart of CIRS podcast, and a recovering CIRS patient on step 12 at the end of the protocol. I want to start off this talk today leaning into how I organize areas of CIRS support for people going through the recovery process. So I break it into multiple areas so folks know where to target their attention. Medical support, so your CIRS doctor, practitioner, healthcare professionals, allied health folks. Environmental support, your IEPs, coaches, peers. Brain and mental health support. This would be your psychologist, psychiatrist, counselors, grief support, mindfulness meditation, nature, breath work, coaching, somatic practitioners, time with animals or friends or cuddling. Emotional support can very much overlap with brain and mental support and also include things like art therapy, journaling, emotional support sessions, emotional awareness, naming, meditating with emotions. Physical support would look like accessibility aids, people to help clean and cook and drive, air filters. Financial support would be loans, refinancing, credit cards, budgets, discounts, short-term disability, Social Security disability, resources for food, electric, gas, and housing due to income, and community support. So your CIRS-specific support groups, spiritual groups, connections with CIRS allies. So mindfulness meditation as a CIRS support falls into multiple areas. It can be brain and mental health support. It can be emotional support. And if practicing in a group, community support. I want to share a quote by Thich Nhat Hanh, Vietnamese monk, who writes in No Mud, No Lotus, The Art of Transforming Suffering, most people are afraid of suffering, but suffering is a kind of mud to help the lotus flower of happiness grow. There can be no lotus flower without the mud. No mud, no lotus. Here is maybe a provoking question for you. Can CIRS mud be the grounds for growth and happiness? Let's start framing mindfulness meditation and including what it isn't to get to what it is. Sometimes when people are not involved in spiritual worlds or healing arts, everything gets lumped into one category. So mindfulness meditation is not visualization. It is not mantra practice. It's not future self or striving for a particular energy or vibrational frequency. It's not chakra meditation. It's certainly not bypassing unpleasant feelings to force pleasant emotions. It's not breath work or breathing in a certain way. And mindfulness meditation is not yoga asana practice. Now, meditation's a limb of yoga, but mindfulness meditation has its own path, which you will see later on in this talk. So what is mindfulness meditation? It can be translated to mean to remember, to come back to return. It helps people to notice when they're not present and remember, come back to, return to present moment experience. When you remember and return and come back to the present moment, this can be very powerful because we're not caught up in our mind and emotions. It means being present without judging and being open and kind to whatever is happening. Most people aren't aware that they are not present. They don't notice their body cues and are often pulled around throughout the day by limiting thoughts, fears, and emotions. So mindfulness meditation practice wakes people up to what's happening. And when you're present, listening to the body, not getting caught up in unhelpful thinking and allowing emotions to flow, the result can be a feeling of more capability and resilience with whatever difficulty comes along. And we certainly know there are many difficulties navigating a CIRS recovery. Being present to your body and thoughts and emotions helps to reduce the amount of suffering a person can experience as they go through recovery, because they learn how to work through the mental and emotional stress, develop resilience, and stay present. And they learn to make positive choices that impact their recovery. What does the research say about mindfulness meditation and the limbic system? This is very important to touch on because we hear so much about limbic system retraining in the CIRS world, and it is very important, and mindfulness meditation can be considered a very simple, practical, easily accessible tool to help heal parts of the limbic system, along with the medical steps you're taking to heal your brain. Mindfulness meditation, it helps to regulate the nervous system out of fight, flight, freeze, and fawn. It promotes a parasympathetic calming nervous system state. And so it calms an overactive amygdala, decreasing its size. So you can be in a place of rest and digest and feel less anxious. Mindfulness meditation has been shown to create new neuronal pathways, improving connections in the limbic system with the frontal lobes for improved emotional regulation and critical thinking. Sounds helpful for CIRS folks. Mindfulness meditation helps to grow gray matter in the brain, specifically in the hippocampus, which helps with memory and learning. We definitely want to support that area as well. This practice helps to decrease feelings of depression. It improves sleep quality, helps people feel less fearful of situations that happened in the past, should they happen again. Also highly beneficial. If a water event happens in the future, people can learn to feel less fearful. Mindfulness teaches people how to be kind and compassionate to their needs through loving kindness and self-compassion, very important. And it helps to support immune functions. As a CIRS patient, when is a good time to try mindfulness meditation? I've been teaching and guiding people through mindfulness practices who have a CIRS diagnosis for over a year now. And what I'm seeing in my current recommendation for folks is to start a mindfulness practice or restart a practice when you're passing the VCS and are around step 3 of the Shoemaker protocol. Because at this time, the inflammation begins to come down and you're left with a brain that needs some help and assistance to heal. And we have VIP to help heal the brain, and this can be a supportive therapy to help that process. If you had a prior meditation experience, you might be able to start up a practice prior to step 3, but I see this being as the exception. I recommend people begin 5, 10, 15 minutes and then go beyond that, depending on your comfort level and level of healing. And so many people are really in survival mode prior to step 3. You have had to find housing, get on binders, start eliminating Marcons. And so once that begins and the inflammation comes down, meditating regularly can be something to incorporate into a daily routine. Simple nervous system strategies like alternate nostril breathing, mindful moments, humming, weighted blankets, co-regulation with music, pets, people. Some of these are more helpful in the early steps before trying mindfulness meditation. What are people reporting in real life from practicing mindfulness meditation during their CIRS recovery? This is accumulated from the people that I've worked with. They are reconnecting with the body and reducing disassociation, that feeling of leaving the body or being above the body, and an improved relationship with their body with time. They're reporting an ability to stay calm in previously triggering situations, so returning to a parasympathetic state more quickly and easily, or showing that they can remain calm and present in the midst of a challenge. Maybe seeing a water leak in a difficult conversation or sensing an exposure. People are showing that they can name and process emotions. They're developing the ability to sense in the body what an exposure feels like. They can feel when a treatment is working and not working by having a way to describe the response as felt in the body. And they're finding meaning through a felt knowing of CIRS as a teacher. And they're understanding challenges and knowing that they can become opportunities for personal growth. Everything in life does shift and change. So you're curious and want to meditate. Now what? So first off, practically, you want to find a place to practice. So how can you set up your environment to be supportive to you? Is there a place where it's quieter or cozy and comfortable? And you need to choose a position that really fits your physical needs that day. Maybe it's sitting, lying down, standing, walking. The type of practice is important. Are you going to listen to a guided meditation? Are you going to practice with a community or by yourself? And what type of mindfulness practice? Breath, sound, emotion. We'll talk more about that later. Choosing a time of day when you're not too tired and relatively alert, not rushed, is a good time to practice. And you want to think about the frequency. If you're brand new, I often recommend that people try 5 days a week for 5 minutes and start to build up something reasonable from there. 5 minutes, 10 minutes, 15 minutes, or more. I have created a meditation basics mini course for people that are meditation curious and want to get started that fits this need and guides you through 5 days a week for 5 minutes to help you jumpstart a meditation practice and try it out. One piece that's important to touch on when it comes to mindfulness meditation is thinking about making your practice trauma informed. It's important to consider and acknowledge if you feel you've experienced trauma in the CIRS diagnostic and recovery process. So a CIRS experience can re-trigger past developmental trauma or uncover suppressed trauma. And if you feel drawn to try meditation and identify as a person with trauma, it's important to allow yourself to go slowly and not push through feelings or flashbacks that might come up, because this can happen when you turn inward and start paying attention to the inner landscape. And if intense nervous system dysregulation appears when starting to meditate, this could be freezing, this could be really feeling claustrophobic, this could be feeling very stressed when you're looking inward, then it's highly recommended to pause and work with a somatic trauma-informed practitioner before resuming a meditation practice. So you don't want to push through that. Trauma actually lives in the body. A trained professional that can help work with that experience can help then lead to stepping into a meditation practice. It can help the process, and then you may feel more comfortable. Some strategies for a trauma-informed meditation practice include options. You can decide if you want your eyes open or closed when you meditate. You can choose your position, seated, reclined, lying down, standing, or walking practice. And you can choose what you want to focus on. So your attention could be on sound if you don't like focusing on the breath, if there's some difficulty related to an experience with breathing. Or you might choose to feel your breath if the body sensations all over are not very comfortable. Or you can focus on the sensations as a whole. So there's a lot of permission to explore, to take breaks, and to stop if you need. I've been talking for a little bit, and I do want this to be educational and experiential. So let's do a short practice and see, how do you feel? Let's start off with a guided grounding meditation. Grounding practice helps with transitioning out of the busy thinking mind to slow down and reconnect with the body. It invites in a calming parasympathetic nervous system state, and it helps you to sense into a quality of steadiness, groundedness, and that unshakability of a rock. You may be able to recognize in your own CIRS experience the benefit of finding a way to feel steady and grounded. So wherever you are watching and listening to this talk today, if it feels like a comfortable time, I invite you to maybe close your eyes and bring the attention inward. And if that feels uncomfortable in any way, I invite you just to simply place your gaze at a neutral spot, maybe on the ground or the wall, something that doesn't grab your attention, that's just plain and calming. Shifting the attention out of the mind, out of everything I just said, to sense and feel low to the ground. Really feeling into your feet on the ground. And noticing where your feet or lower body make contact by the sensation of pressure or weight, maybe in the four corners of your feet. Or the legs resting on a bed or a sofa. And your bottom heavy, resting on whatever you're seated on or laying on. And your mind may want to be very busy. I'm inviting you to feel connected to the ground and earth underneath you by shifting away from thinking again and again to feel your feet and feel the lower part of your body. And so we have these places of contact, the feet, our hips and bottom. And there's also another place that we can feel grounded for some underneath the belly button, the hara space, the deep place of breathing. You can just focus your attention there and see what that feels like. And just noticing for a moment what feels steady. your feet, your bottom, the lower part of your belly. That could be a place that you can sense into for grounding. And just staying with it for a few seconds longer. Just allowing your body to move a little bit. And if your eyes were closed, taking in some different visuals around the room. And so you just meditated. Well done. And maybe if you are listening to this in a car or in a different situation and you didn't practice, you can always come back and listen to that again. So how did you feel? Were you able to sense into some groundedness, or are you feeling a little disassociated? Just noticing what the impact of the practice was on your body. Let's talk for a minute about where mindfulness meditation comes from. These practices come from Buddhist philosophy from 2,600 years ago, the origin now called India. And it was developed as a path to freedom and to find freedom from a life of suffering. Siddhartha Gautama, the Buddha, was born to a Hindu family and eventually achieved enlightenment from these practices. And the teachings of the Buddha were passed from teacher to teacher over the years, eventually turned into Buddhism as religion and its different forms in various countries. Mindfulness meditation is a central component of the original teachings. In the 1970s, teachers like Jack Kornfield, Sharon Salzberg, Joseph Goldstein, they brought these teachings from India to the United States in the American Vipassana movement. In 1979, American John Kabat-Zinn introduced mindfulness-based stress reduction, MBSR, to University of Massachusetts Medical Center, really for purposes of working with chronic pain and stress disorders. MBSR and mindfulness has since been heavily researched for supporting many health areas and diagnoses over the last 40 plus years in terms of nervous system regulation, stress reduction, positive brain changes, immune system regulation, emotional intelligence. When I'm guiding and teaching people meditation, I'm actually going down a path. We have a shoemaker path, a triangle we follow, and here is the path for the 4 foundations of mindfulness. You'll see on the left, mindfulness of body is where we begin. So we just did a grounding meditation because we want to develop a grounded presence, the ability to live and feel in our body and calm our nervous system. Other practices such as mindfulness of body, a body scan, breathing practice, exploring the different postures, sitting, standing, walking, reclining, and even paying attention to activities and actions in daily life fall under this mindfulness of body foundation. Then people begin to explore their reactivity to patterns, to life experience. Feeling tones helps us to better understand how we react to everything that happens in our life. Whether you realize it or not, you're registering things as pleasant, unpleasant, or neutral. And this is really important because when you start to pay attention, you can shift from hating and judging an experience to taking a step back, neutralizing it a bit by labeling it as unpleasant. It actually creates some space between the CIRS challenge when you step back and simply label it as unpleasant versus going into a spiral of thinking. We can notice pleasant experiences as well, which is also so important in a CIRS recovery. We want to be able to savor and notice when some good things happen. That really improves our well-being. And it's also important to notice that some things are really neutral and that not everything is pleasant or unpleasant. Sometimes experience is just experience. I then start to guide people into understanding their mental and emotional states. So the benefit of this is emotional regulation and maturity, less reactivity to emotions and thoughts, development of wise responses, improving emotional well-being, and having a better relationship with a thinking mind. So many people think meditation is about clearing the mind and then they're meditating. Actually, through this foundation, we're learning that we can meet the mind and see the thoughts and work with them. And that is meditation practice. So you see where the mind goes, maybe in the future, into fantasy, stuck in the past. We can see that inner critic, the judge that critiques and provides unhelpful commentary on life. This can show up in CIRS recovery very strongly. The doubting mind, the questioning mind, the fearful mind. All of this is important to see because it really impacts how we relate to the CIRS experience. Mindfulness of emotions. This also is such an important place to explore in CIRS recovery and very alive for many of the people that come to the mindfulness classes and courses. We want to learn to metabolize and let emotions flow through. So we want to be able to name what's present and what needs to be felt, released, processed, moved through. In CIRS, there's a whole field of emotions. There's grief, there's fear, there's sadness, there's anger. This needs to be acknowledged. And we also want to be able to notice the positive emotions as well. Lastly, the final foundation that I guide people through is learning to look at your life experience differently, developing a real trust in life, developing the ability to make choices wisely, discern what's helpful and not helpful. Meditation points to change. Everything changes. People tend to get stuck in thinking their health won't change, they'll never find a house, that the numbers won't go down, that they'll never kick their Marcons. And we want to challenge and see through that. And by remembering change, it helps to reframe that thought. Meditation also points to suffering as optional. Life is difficult, but we have the power to choose how we meet the difficulty with gentleness, kindness, with an appropriate response, instead of with hating it, fearing it, which leads to more suffering. Meditation points to life as impersonal. And so you don't have to take everything so personally. It's not your fault that CIRS happened to you. Everything in life is a result of causes and conditions, genetics, stress, trauma, mold, bacteria. All of this brings CIRS. You did not do something wrong. And we learn to see the bigger picture of life as we go through the 4 foundations of mindfulness. There are other heart practices that are very important for people to develop so that they learn to be kinder to themselves as they go through their CIRS recovery process. Loving kindness practice meditation, metta practice, it's where people repeat in their mind phrases that wish themselves and others happiness, ease, and peace. And it's very soothing when distress or fear arises. It helps you to develop positivity towards yourself and improve social connections with others. It helps to provide a daily experience of positive emotions. It can reduce anger, pain, psychological distress, improve vagal tone, and increase areas of the brain connected to emotional regulation. This has all been researched and studied. These are the powerful benefits of a regular metta practice. I've included some phrases here that you might want to say to yourself, repeating the phrases in your mind along with the own rhythm of your breath. And so if you really have a busy mind or a spiraling mind of some sort, this helps to concentrate and plant the seeds for kindness and happiness and ease. To take heart practice one step further, we can lean into the idea of self-compassion or karuna. Self-compassion is really about learning to be with yourself in the midst of very difficult circumstances and suffering. As you go through CIRS recovery, it's very common. There aren't as many people as you thought that can hold space and be with you in your suffering moments. And we have the power to be present and to support ourselves through self-compassion. So we can repeat phrases and cultivate genuine sympathy for ourselves in states of suffering and express a wish to really ease that pain. Self-compassion moderates reactions to challenges such as failure, rejection, embarrassment. Less negative emotion can be present when confronted with real, imagined, or remembered negative events. Self-compassion makes it less likely that you'll ruminate about negative events, and there's a willingness to accept responsibility for negative experiences. Self-compassion has been shown to deactivate the stress response, activate care responses, decrease cortisol, and increase heart rate variability. Less defensive, more resilient, highly beneficial for a CIRS patient. And again, this has all been researched. There will be all of the references at the end of the slides. There are again some self-compassion phrases that you can explore in the same way that really meet you in your suffering. Let's get into some of the CIRS experiences that people have that are common and talk about which meditation do you choose. I've gone over many types of practices now. Mindfulness of body, feeling tones, working with emotions and thoughts, talking about change, and also heart practices like loving kindness and self-compassion. A common CIRS experience that we'll start with is feeling disassociated, out of the body, floating above the body, not connected to the body or the world. Grounding meditation or mindfulness of body is really helpful to find internal stability, calm into a parasympathetic state. A guided body scan, safely, slowly, methodically can help you feel parts of the body and find some safe places to feel. Mindfulness of breath, feeling and following the natural rhythm of your breathing can be helpful. And feeling tones, so learning to sense the pleasant, unpleasant, neutral experiences can help us have less fear around challenging body experiences. Push crash is another common CIRS experience. So that's being unsure when to stop, pause, or pull back on physical activity. When you're practicing mindfulness of body or body scan, you really learn to sense and feel what rested versus fatigue feels like in your muscles and your nervous system. You can pay attention to your body parts and you start to notice subtle cues which inform when do you need to take a break or when you need to continue your activity. Feeling tones, noticing if something's pleasant, unpleasant, neutral, can help you learn to stay with the body sensation of fatigue so that you know when you need to take a break. And self-compassion, again, learning to be kind and compassionate to yourself when you are feeling fatigued is very helpful because people often judge their body limitations with CIRS recovery. For the doctors out there, treatment feedback. Doctors want to know, practitioners want to know, how is this working for you? And people are sometimes unsure if something is working or how to describe what the body's doing and related to an exposure or medicines or supplements. Body scan, mindfulness of body, again, really helps us to know in a variety of conditions, what does my body feel like? So then we learn and notice and can give feedback on the types of experiences we're having. Feeling tones, again, is very helpful in this area, and mindfulness of thoughts. So we need to notice the mind commentary around what's happening. For example, this will never work when they're thinking about a nasal spray. This can get in the way of actually sensing the impact of the treatment on the body because they're so focused on the mental chatter. And so noticing that there's some thoughts going on and feeling back in the body can help somebody actually describe what's happening with the treatment. It's very common for CIRS people to feel overwhelmed by choices, actions. Where do you live? What do you do for support? There are so many choices that a CIRS person needs to make in the midst of really difficult times. Really grounding and mindfulness of body, breath. These practices help a patient to find internal stability, reestablish that calm nervous system state, can feel supportive to notice the breath rhythm. If you're overwhelmed, mindfulness of thoughts practice, helping to notice and let go. Oh, I'm overthinking. Helping to quiet that inner critic that's judging and commenting on your CIRS recovery. Overwhelm, mindfulness of emotion practice helps us to name and work with the fear, the doubt, and the worry. Walking practice can be really helpful here. Moving activated nervous system energy to develop concentration in the mind versus spiraling in thoughts is helpful. And loving kindness meditation is the antidote to fear. Offering kind phrases to self and to others helps to concentrate the mind, soften the heart, and move through that fearful moment. Reoccurring cyclical thought patterns. Busy thinking minds prevent getting through the day sometimes and making decisions or moving forward. Mindfulness of thoughts, noticing what is happening in the mind that's preventing you from moving forward. Is there a pattern that you're always planning, but not making the decisions you need to make? Is there fantasy? Are you stuck in this idea of what should be happening versus what is actually happening? Is there avoidance of the reality? Is there replay of conversations and thoughts? Mindfulness of thoughts practice helps with that. Noticing the breath and the senses, continually coming back to our body sensations versus attaching to the thinking is helpful. Mindfulness of activities, so really paying attention when you're cleaning, washing dishes, everyday life. This can help to develop a continuity of presence, get us out of that thinking pattern. Mindfulness of emotions. Oftentimes, with a reoccurring cyclical thought pattern, there's an underlying feeling that needs to be acknowledged, fueling the repetitive thought. So that's something that can be worked through with the mindfulness of emotions practice, and certainly self-compassion. So bringing compassion to the self in the midst of a really busy, ruminating mind. Common that there are a lot of emotions in the CIRS recovery process, and feeling, processing emotions is highly helpful with the mindfulness practice. being able to name and process feelings like anger, frustration, sadness, grief. We can do this by first grounding and getting comfortable being in the body. We need to have internal stability, reestablish a calm enough state to explore the emotional life. We want to name and feel emotions so that they move and dissolve. We want to notice the thoughts, letting go of the inner critic. Feeling and processing emotions can be very helpful when you're reclining or laying down. It's a more vulnerable position that allows feelings to actually move through the body. And loving kindness and self-compassion practices, heart practices help to soothe the system after all of the emotional processing. Anxiety. Prior to interactions that you might need to have or events in CIRS recovery, doctor's appointments, blood draws, home inspections, ground and reconnect to the body. Find that internal stability. Again, paying attention to the thoughts and the emotions, self-compassion practice, meditating with that anxious, suffering part of yourself without judgment can really be healing. And loving kindness practice, wishing yourself well to disrupt the anxious thought pattern. May I feel calm? May I feel relaxed? May I stay grounded? It can help concentrate the mind and shift out of the anxious moment. Let's talk about the power of practicing meditation with a community. Habits are challenging to start, especially challenging during a CIRS recovery. So you want to set yourself up for success with any sort of limbic training, mind training practice that you want to do. And showing up for other people and seeing other people show up for you in a group meditation is really powerful. Meditation for CIRS has a membership, and I offer this through the Practice Portal, which is my online platform. There's a private space for people to practice meditation live with a teacher, which is me, and a group of people that are also going through CIRS recovery. This happens right now each Monday night. And it's intentional on a Monday, so you can start your week off mindfully in a state of awareness and presence. There's private spaces where you can contemplate and reflect on your CIRS experience and meditation impact. This is really important for learning and developing wisdom and discernment. I offer quarterly mindfulness workshops for CIRS folks. And you could be a part of research that helps to bring more information on mental health and emotional strategies that are specific to the CIRS population in this membership. I am in the process of collecting data to help show the benefits of mindfulness meditation specifically with the CIRS population. It can be hard to be motivated to do new things. So meeting with a teacher in a group can help get you started, get you going. And then there's the opportunity to ask questions if anything comes up along the way. Jessica McGuire says, a healthy nervous system is not always calm. It is flexible and resilient. And this is something that I see to be one of the most beneficial pieces of a mindfulness meditation practice. You begin to notice when you're activated, when your nervous system needs to come back into a parasympathetic calming state. You learn strategies to ground, to flow with the everyday challenges of life, and really how to work with all of the challenges in a CIRS diagnosis and experience. I just want to close with saying how mindfulness meditation has been such a support and framework for how I go through and navigate my own personal CIRS recovery. I've had a very significant presentation, and without these tools, I don't know where I would be. I feel very confident that they can be supportive for some folks on their CIRS recovery. And if anything that I've said today feels like it resonates with you, I do hope to see you in the future in a class or a workshop. Please stay in touch. I'd love to invite you to join the private meditation for CIRS community on the practice portal. It's specifically designed at a low price point so that you can stay a part of your coaching collectives and groups and add in a place that is specifically for your mental health and brain health. I share free content on Instagram, Meditation for CIRS, and there are also free meditations on SoundCloud. I offer one-on-one meditation mentoring and grief support, and you can find more information about those sessions on my website. And you can also listen to the Heart of CIRS podcast on Buzzsprout or all of the podcast locations to really feel into deep, heartfelt conversations with people going through CIRS recovery and the providers that are really committed to helping CIRS patients. Lastly, there's my email there. And for Dr. Shoemaker, all the research. Thank you for your kind attention, and I hope that you have found the content to be of benefit.